Hello everyone, I welcome you all to today's episode 1 on the surprising facts about stroke. In a single minute, someone in the society has a stroke. It is a sudden neutral event that kills thousands of brain cells in shortest time. Would you know what to do if you saw someone having one? In today's episode, we are going to address few of these issues and also to familiarize you with the different types of strokes and how to be smart to apparently save someone's life. Stroke Association Support Network Ghana, with coalition of Komfo-Anokye Teaching Hospital, has put health measures in the massive communities, creating awareness on early signs of stroke illness. So, health specialists, youth in the community, the government and voluntary groups have all adhered to this call to action, stroke health awareness. And this has quickly developed a growing movement to identify and manage early stage on the syndromes. So we have John here, who was once a victim. John said he was a stroke victim and he was brought to the hospital, where the stroke team immediately activated their clinical protocols to quickly and assess, diagnose, and treat John. So after determining that John had sustained a stroke due to a blood clot in his cerebral artery, he was given a clot-busting drug TPA and then stabilized and transferred to 37 Hospital in Greater Accra region. John now has two issues, a poor stroke and a cardiac condition, Barbara said, whose nursing knowledge and skills have been put to good use throughout her husband's ongoing recovery. So John said he is inviting all friends to get an EKG as part of their regular checkup. Some of the signs on early stage usually resolve shortly after the patient leaves the intensive care unit, which is ICU. The ICU syndrome is a type of organic brain syndrome manifested by a variety of psychological reactions, including fear, anxiety, depression, etc. The ICU physician may last 24 hours or even up to 2 weeks with various symptoms occurring or at different types of ICU syndromes. Psychiatric Intensive Care Unit (PICU) in patients and families is also the focus area of the Support Network broadcast episode. A psychiatric intensive care syndrome is a collection of physical, mental, and emotional symptoms of a stroke patient. The patient's length of stay is normally short, rather than prolonged, as the patient should be treated and returned to an open ward as soon as their mental health state is stable. We cherish all our listeners who are listening to this episode 1 on stroke health issues. Therefore, we invite everyone to continue listening to the upcoming series of our episode. Thank you.